Hi, everyone. My name's Jessica. I work here at Stall Vision. We are going to talk about cataracts with the doctors today. Hello, everyone.
Hey, Jess.
Hello.
How are
Yes.
you?
Hey, good.
All right. Well, Dr. Stahl, tell us a little bit about your background.
Yeah, just welcome. I know a lot of you are just now signing on. We'll let some sign on as we go over just a couple things. So we actually just celebrated our 30th anniversary here at Stall Vision. So I grew up here in Beaver Creek and did all my schooling up at Ohio State. I've been practiced 30 years and been lucky to have some awesome partners join me. In our practice, we mainly specialize in cataract surgery and LASIK surgery.
Dr. Knowles?
Yeah, I'm Jim Knowles again. I went through med school at Mayo Clinic and then residency in aerospace medicine, and then later ophthalmology. I was chief of the ophthalmology department at Wright-Patterson Air Force Base. I've been with Stall Vision now for 19 years, so it's been great.
That's awesome.
Yeah. Dr. Gillis?
So hi, I'm John Gillis. I just celebrated my 1 year anniversary working here at Stall Vision.
Right.
Like Dr. Knowles, I was trained. I went to the military medical school for my med school training, and then I was trained at Wilford Hall for my ophthalmology residency. And then, like him, was chief of Wright-Patterson as of last year. However, got out and just enjoyed working here at Stall Vision for the last year.
All right. Great.
And happy to have you.
Yes.
Yeah, it's been a great job.
Dr. Saul, let's start with you and tell us a little bit about what a cataract is and how it affects your vision.
Yeah. If we all live long enough, we're all going to get cataracts eventually. Cataracts where the lens starts to densen, turns yellow, turns cloudy, and eventually that gets cloudy enough, it starts affecting your vision. And that's when you or your doctor will start saying, hey, now you have a cataract. It's a process, when that actually goes from, well, it's early cataract or pre-cataract. Cataract depends on when it starts affecting your vision. But if we live long enough, we're all eventually going to get a cataract, and it makes your vision turn yellow, cloudy, and blurry. A lot of glare. Most people compare a lot of glare at night.
Okay. Are there different types of cataract?
There are different types of cataracts, and even within a cataract, there's different subtypes within it. So most people have different components to their cataract, but there are some cataracts that young people sometimes get, sometimes even their teenage years, that cause a tremendous amount of glare at nighttime. There are cataracts that diabetic patients tend to get, so there are different types of cataracts.
Okay. What are the common causes or risk factors for developing cataracts?
Yeah, the number one risk factor for cataracts is age, right? It's more common as we get older. And all of us, if we live long enough, are going to get cataracts. There are a couple other risk factors. We know that diabetic patients and patients with other significant medical problems sometimes get cataracts earlier. Taking steroids, oral steroids or intravenous steroids for a long period of time sometimes cause cataracts. There is some controversy about it, but there's some question that sun exposure may cause cataracts. We certainly see that people in the tropics develop cataracts at a much younger age. And then there's certain medical problems that are known to trigger cataracts. So those are the big risk factors. And of course, there's a genetic component. Certainly some people have the cataracts develop in their family at a young age, and they develop cataracts too.
Okay. Dr. Knowles, what are the early signs and symptoms of cataract?
Yeah, so the symptoms of cataracts are basically blurry vision. You have a painless, no pain, progressive, increasing loss of vision, typically no redness. Happens over months to, maybe a year or two, even fairly slow, not super rapid. And again, that's blurry vision that starts to affect daily activities, reading, driving, hobbies, things like that. When it gets to the point where it's impacting your lifestyle, then that's the time to get that checked out.
Okay. What or how often, or how's cataracts diagnosed and what tests are typically done?
Yeah, so in the midst of a thorough eye examination, typically a dilated examination, that can be diagnosed by your regular optometrist, or it can be diagnosed by us or other ophthalmologists. So it's a full dilated eye exam. We'll look at the lens of the eye. That's where the real problem is. We see cloudiness of the lens, but there may be other things going on. And we do a very detailed examination, not only just dilation. We measure the curvature of the cornea in front. We measure oftentimes what the health of the retina is behind at the back of the eye, just to determine, is there anything else going on that could be contributing to blurry vision, or is there anything else that could cause an issue or a decreased vision after surgery that would be independent of cataract.
Can a cataract be mistaken for another eye condition?
Typically, when you have a big, thorough eye examination, which again can take an hour to even 2 hours for a very thorough eye exam, we'll know the condition of your eye inside and out. We'll be able to tell, is there cataract there or is there not? So that's a pretty straightforward thing. But oftentimes there may be other coexisting issues with the eye. There may be glaucoma, there may be diabetic retinopathy, there may be retina issues, things that can also cause blurry vision. So then some people may have just one primary cause of blurry vision, cataracts. Other people may have several causes of blurry vision. Then what we do is we evaluate those and have a discussion with you about what impact those may be having on your vision, whether that's going to affect our doing cataract surgery, et cetera. So you'll know it's not an easy thing to miss.
Okay. Dr. Gillis, how do you determine when a patient's ready for cataract surgery? Or when
So,
the cataract is ready?
so a lot of people come to us thinking that they have to wait till their cataract's right. That's kind of an old wives' tale or something that was maybe thought about in your grandma's cataract, but now is not necessarily true. So that's where getting back to when it's starting to affect your activities of daily living, whether the glare is causing you trouble at night driving. And a lot of people will be seeing their eye care providers getting contacts and or glasses for correcting their vision. But your regular doctor usually will tell you when the eyes can't be improved by cataracts or contacts, in which case they'll refer you to surgeons like us, or if you are on our online website and take the common symptoms of cataracts, you may decide that it's something to come and see us for a consultation to see if it's impacting your vision.
Okay. And is there any medicine or eye drops other than surgery that can cure a cataract?
So if you go on the internet, you'll find a cure for anything. But
Dr. Google, right?
Dr. Google will find you a drop to cure that. But no, that is myth. So there are no drops that will dissolve your cataract. So it is considered by all definitions a surgical disease, meaning we can cure it or improve it with surgical techniques to take out the cataract. And there's no other medical treatments once it gets to the point where it's affecting your vision to improve it.
Okay, that's good to know. Dr. Saul, what does cataract surgery involve, and can you explain the procedure?
Yeah, the process, you'll come in for your exam. It's a very thorough exam. You're going to want to plan on being here 2 hours, and we will dilate your eyes. So you might want a driver that day. And then that will have a driver or somebody with you. They can help go over some of the instructions with you a little bit later. We'll get all the appointments scheduled for you. There is an appointment to have a history and physical done. There is an appointment to measure for your implant lens. When you have cataract surgery, you need an implant lens to take the place of your own natural lens, and you're measured for that. Each person has their own specially ordered implant lens for them. The day of your surgery, you'll definitely need a driver because you're going to be sedated a little bit. Plan on being in the surgery center probably about 2 hours that day. You do get to go home, of course, that same day. And our surgery center is here in the office. You're only actually in the surgery room about 20 minutes. So it's a fairly rapid or fairly short surgery to have done. And then we're going to see you the very next morning afterwards as well.
How has cataract surgery evolved over the years?
Yeah, the surgery has changed tremendously. I mean, even a few years before I started practice, patients were admitted to the hospital and stayed for a couple of days. And the recovery was very long, and you weren't allowed to bend over, and there were all these restrictions. Well, that was grandma's surgery, or great grandma's surgery now, all right? This is not your grandmother's surgery. You go in the hospital in the morning, home the same day. There's no sutures used with modern cataract surgery. The restrictions are minimal. Certainly, you don't want to be lifting weights and don't want you driving the very next day, but some people can start driving very shortly after that. The recovery is much faster. The implants we have astigmatism correcting implants, bifocal implant lenses. The technology to just take the cataracts out is improved. That's why the surgery is much more rapid and much more safer now than ever. So in the 30 years I've been in practice, the advancements in cataract surgery have been tremendous.
Good. What is the recovery process like, Dr. Saul?
Pretty.
Go ahead.
No, you go ahead.
Okay.
Okay.
Yeah, so as Dr. Stahl was detailing the experience of the surgery, so post-operatively, we'll have a shield on to protect your eye. You'll go home. You'll start some medicated drops after a good, nice, long, well-deserved nap. And then we'll typically call you in the evening, make sure you're doing okay. And then we see you the next day, and we'll check your vision pressure, all that, review all the drops. We'll start some drops, and you'll have a little checklist that can allow you to make sure you're following all the post-op follow-up instructions. So we'll see you on day one, and then we'll review everything. We do have you wear a shield at night for the first couple of weeks so you don't inadvertently rub your eye. You don't want that. And then we'll have instructions on how long to take different types of drops, antibiotic, anti-inflammatory, steroid drop. And we'll see you on day one. And then typically about 2 weeks after the surgery, vision can be improved very rapidly, even on day one, but oftentimes it's about 2 weeks before we know it's finally stabilized. And at that point, then we can do our final exam. And then if you're having the other eye done, it's typically about, 2 to 3 weeks after the first eye.
So the vision, it doesn't take that long to improve after surgery.
No, it kind of depends on, what your vision was like beforehand, issues, with the surgery, typically it's much improved very quickly. We have people who are seeing a diet post-op today at a large percentage of people, 2020 are very close to that on day one.
Great.
Yeah, so that's a great question. We got a off-camera question from Lakin, and the question is, what sort of improvements can somebody see in addition to just they're seeing better? They're going to see colors are going to be brighter, especially the whites and the blue spectrum, because the cataract is sort of a yellow-brown discoloration of the natural lens. So it's kind of a blue blocker that gets really thick and starts to make vision blurry. So it'll be clearer, better definition on things, crispness, clarity, color, the whites, and especially the blue spectrum. I have patients, especially patients who are artists, and they're very tuned into all that. They go, whoa, I didn't realize what I was missing.
Yeah, we hear that a lot.
Yeah.
Dr. Gillis, what should a patient consider when choosing their surgeon or even a clinic for surgery?
Well, it's a big decision, and a lot of people feel overwhelmed because there's a lot of choices out there. When you're choosing a clinic and or a surgeon, you want to know their experience level. We've got great, highly experienced surgeons here. You want to consider your comfort level and how you feel when you go to the office, and when you're going there, how efficient and how easy it is to be seen, and then also to schedule your surgery. And those are some of the things that we excel at here at Stall Vision, is to have people that are experts at every level, from when you first check in to when you leave.
How do you address the patient's fears or, just being worried about cataract surgery?
So many people are coming and are very anxious, and that's a very common thing. Eyes, even in the most bravest of people, can cause people to squirm. And so we're very experienced and used to people being very anxious. Some people are a little bit anxious, and then we have people that are quite anxious. And during the surgical process, we've got our anesthesia colleagues that help you, give you some relaxation medicine to help you get through surgery, keep you comfortable, and make it surprisingly painless and quick procedure. Many patients, even the most anxious, are many times surprised at how quick and painless it is, and how much even they had a perceived anxiety, how easy it was for them to get through the surgery. So we're used to patients having a fair amount of anxiety, but we're able to get everyone through the surgery as painlessly as possible.
Okay, good. Dr. Knowles, or Dr. Stahl, can you, cataracts reoccur after surgery?
The cataract doesn't come back. Everybody thinks that, but yeah, you only get it once. Now, there is a thin film that develops over the implant lens. We can clean that off with a laser, fairly simple to do with a laser surgery. Only need that done once. It's a very simple and straightforward procedure, but the cataracts don't come back.
Okay. What about lifestyle changes to prevent cataracts from even forming?
Yeah, we think that if you're taking multivitamins with minerals, you're eating more fruits and vegetables, that you may both be able to delay the onset of cataracts and slow the progression of cataracts. So I encourage everybody to do that. There is some question about whether wearing sunglasses and avoiding a lot of sun exposure may slow cataract progression. Certainly, if you're diabetic, you want to keep your blood sugar down, not just for the sake of cataract, but for all sorts of things in your eyes. You want to keep good blood sugar control. And then if you are on prednisone or steroids for some reason, you want to be on the lowest dose that can control your conditions that you need to be, because we know steroids in long term will eventually cause cataracts.
And what should patients expect for cataract surgery, like long term after?
Some people experience this where you go through 2 or 3 different pairs of glasses leading up to cataract surgery. Sometimes you go through 2 or 3 different eye doctors leading up to cataract surgery until you figure out it wasn't the glasses and it wasn't the eye doctor. It was the cataracts causing the problem. But this should stabilize your eyes. The part of your eye that was changing, the lens, comes out. That was the cataract. But an artificial implant lets in that lasts the rest of your lifetime. So it usually stabilizes your vision. As long as your eyes stay healthy, otherwise, you should retain good vision for a long time.
Okay, good to know. Dr. Knowles, does insurance typically cover cataract surgery?
So yeah, typically that's a great question. People always ask that. They want to know that because that's a big driver for things. They don't want to do things unless insurance covers it. So insurance does typically cover cataract surgery. The key thing is, again, the cataract has to get to a point where it's impacting your daily activities, reading, driving, hobbies in particular. And we're very specific about doing all the measurements, the objective measurements. We even have a questionnaire that asks you, what sort of things you're being affected by in terms of your daily activities. But the insurance does cover it. Again, example would be Medicare, which with that, there's all those insurance coverage, there's copay, there may be deductibles, you may have a secondary insurance policy. So it's very important for each of us to know exactly what our own insurance is. And our ladies go ahead and process everything through, make sure the insurance is covering your surgery before you have the surgery. But do expect insurance to cover the majority of it, but there'll be copays and deductibles that you may be responsible for. The costs involved are, there's going to be obviously a surgeon's fee, a facility fee, some anesthesia, but all that, is lumped together, and then different parts of that are covered by different types of insurance. Our ladies, we asked them how much typical out-of-pocket cost for, say, Medicare, and for everything for one eye, typically about, in the $500 range, $500 to $700. Again, that varies quite a bit just because insurance plans vary quite a bit.
And then we also offer care credit, which we do 24 months deferred interest.
Yeah.
So that's nice. A lot of people take advantage of that for the advanced lifestyle lens.
Yeah, and it's important to know, you mentioned the advanced lifestyle lens. So the insurance covers the basic standard lens, which is still a very good lens, but technology has gone beyond just the basic lens. We have lenses that give you an advanced, functionality to include correction of astigmatism, correction of range of vision issues. So the goal over time has been to have patients be much less dependent on glasses, and we can get patients pretty much to, oftentimes totally independent of glasses or minimally dependent on glasses, depending on lifestyle lenses that they may choose. The lifestyle lenses are not covered by the insurance. That's important.
That is important to know. All right, so now we're going to take some questions from our live audience.
We'll center this.
There we go.
All right, so we have 2 questions so far. Hopefully people are coming up with a few more. But one of the questions is, will I still need reading glasses after my cataract surgery?
Dr. Knowles was just talking about, there are different types of implants, and that's one of the things that I've seen in my career change tremendously. We're now in the 6th generation of these implant lenses that we put in with cataract surgery, and everybody needs an implant. That's another myth some people don't understand. So there are bifocal implants. So there are implants that if you want to be able to see to read without your glasses on and see far away and medium good out here at intermediate, we have implants to do that. The 6th generation of those implants, they've minimized the amount of night glare you get with that, and really very good near vision. There are implants that correct for astigmatism. You can have astigmatism correction done in your glasses. Some of you may know you have that. You put it in a contact lens, or you can put it in an implant lens. The advantage of putting in an implant lens is you may be able to see fairly clear for distance vision without your glasses, driving, watching TV. 2 or 3 lines better at intermediate. That's that distance where food is on your plate, the dashboard in your car, but you will still need reading glasses with that kind of implant. And as Dr. Knowles mentioned, the regular implant's fine, but most people with the regular implant are still wearing their glasses, some for distance and most of the time for up close. So about half of our patients are choosing to do one of these advanced lifestyle lenses, so they maybe are a little more lens-free. They maybe don't have to wear their prescription glasses after surgery.
While we're on the topic of the advanced lifestyle lenses, can you give us, since they do range in price, can you give us kind of the low price and the high price of those lenses and what they might cost?
Yeah, so I can address that. That's a great question. And we go over that very thoroughly in your cataract evaluation as we summarize the results of that examination. We go over the lens options. And there's basically 3 categories. There's a multifocal, which I kind of call it like the Cadillac. There's a astigmatism correction type lens, which is sort of like the Buick. They still make Buicks. And then there's the Chevrolet option. And all those do a great job of getting rid of the cataract. The insurance covers the basic lens, but the cost of the astigmatism correcting lenses, which give you better uncorrected distance vision, you may still need to be in readers. If somebody has a little bit of astigmatism, it's currently at about $1,500 per lens, and that's a delta above and beyond the basic lens, so that is an out-of-pocket cost. If somebody has more than a little bit of astigmatism, it bumps up to about $1,900 for that particular lens. And then if you go to the multifocal, that has all the bells and whistles on it. So I call it kind of like the Cadillac, and that corrects astigmatism, also gives you a range of vision. So many people are passing their driver's test without glasses, they're reading without glasses, enjoying that advanced functionality. So more bells and whistles, more cost. Cost on that's about $2,700 per lens. above and beyond the basic lens. But as with LASIK and other things that can be, have some cost with it, we have financing options available that can make that very affordable if somebody wants to pursue that.
This one kind of goes along with that also. Do you have any idea why the insurance doesn't cover the upgraded lens?
Yes, I do. Okay, all right. Does anybody have a budget? Yes, they do. Okay, do insurance companies have a budget? Yes, they do. Okay, so funny story, way back when, in the early days of LASIK, some insurances and companies actually covered LASIK
They
for
did?
about 2 days. Okay, and then they realized they were going to go out of money, okay, because it was so popular. In 2005, Medicare looked at everything and they saw this technology coming on board. So these lenses have been around for 20 years now, basically, and they saw this technology coming on, and they realized that Medicare was going to go bankrupt, insurance companies were going to go bankrupt because they were going to be so popular that they said we just have to draw a line there. So they drew that line hard and firm back in 2005, and we'll still get patients that go, well, I know my insurance company is different, it's going to cover that. And we say, go ahead, call, ask all the questions. Nobody covers those lenses apart from the insurance covering the basic lens. So we all want to have it covered, but the reality is everybody, even the insurance companies, have a budget.
Perfect. That was a great answer, by the way. This one goes for all the patients we've seen in the past. So we've had LASIK in the past, we've had RK in the past. Does that affect the outcomes after your surgery? So one question specifically says, I had LASIK in the 90s. After my cataracts are removed, will the LASIK come back?
I'll do that. Because I've had your LASIK surgery.
There's a setup.
There's a setup. So yeah, you have to have a different formula if you have LASIK or radiokeratotomy surgery done in the past, some other different refractive surgeries. We have really good formulas. Matter of fact, we have customized formulas for that specific thing. So a lot of doctors in town are very comfortable doing that, and they send their patients who have had radiokeratotomy or LASIK surgery to our practice because we have very specialized formulas.
Because other doctors are uncomfortable with that.
They're correct. They do not want to do those. They want to send them here where we have a lot more experience with it. Again, I've been doing this 30 years. We have very specialized formulas for it. We get very good results for those patients, better results than you're going to get if you go to somebody who doesn't have that experience doing that. So by all means, if you've had radiokeratotomy or had LASIK surgery, consider coming to us for that because it is something we kind of specialize in.
Does prior refractive surgery affect the lens that they can have?
Yes, it does. So the question was, does it affect which implant I get to have? One thing we've noticed is that if you've had radiokeratotomy or if you've had LASIK surgery and have any irregularities, that sometimes that bifocal implant is not your best choice. The middle implant that we talked about, the astigmatism correcting one called a Toric Plus, is an excellent option for those people because not only can it affect or correct some of the astigmatism, it corrects some other things called spherical aberration in your cornea. And sometimes people see sharper with that than they would with the standard implant lens. So we actually have some implant lenses that are excellent for that particular type of patient.
Perfect. We have one that says, does blue light affect cataracts? Make them grow or?
So a lot of people do wonder about the effects of blue light, computers, LEDs,
A lot
that type of
people do,
things.
and they wear the
Yeah.
blue light blockers.
Right, and I get that, and to my knowledge, I don't know of any good studies that say that there's any adverse reaction. Some people, after being on screens for a long time, especially at nighttime, that can be an activating from a brain perspective as far as like making you less likely to fall asleep or have good night's sleep. But from an eye standpoint, there's not been any studies that say there's any damaging effect to accelerate cataract or eye damaging from blue light. That's different now from UV, where Dr. Stahl was saying that there's some thought that maybe there are some oxidative damaging properties from UV light to both the natural lens that turns into the cataract and or your retina, which may be impactful for people that suffer from macular degeneration. So a little bit different than blue light, but outside UV light, absolutely sunglasses are a good idea. But inside screen light, blue lights, that's kind of if it helps and you feel like it helps, not a bad thing to try, but not anything we recommend consistently.
Perfect. This is a good one. So we've talked about this before, I believe. It's regarding anesthesia for surgery. What if most people want it because they don't want to know what's going on. They they want to be out of it and kind of loopy. But what if a patient doesn't want to have anesthesia because it's hard to recover from afterwards?
Okay, that's a great, great question. You're on mic, so they were able to hear all that. I don't have to repeat it. Okay, so the question comes up, what if somebody wants to have reduced sedation, that sort of thing? Think about three things. When we have somebody, when somebody's going through cataract surgery, there's topical, there's actual anesthesia, which is a numbing drop on the surface of the eye. We put a numbing drop inside the eye. Everybody gets that regardless. And then IV sedation is provided by the anesthetist. They're the anesthesia experts. They're providing IV sedation, which most people choose and want to have. But if somebody does not want to have it, they can still have the surgery without the IV sedation. And then there's another thing called analgesia, and that's typically like a painkiller, like a narcotic, like fentanyl or codeine or morphine or things like that. And for the rare exception, we can provide that for some patients. But if somebody comes to us and they want to have the surgery, they will always get the topical anesthetic, the inside the eye anesthetic, but we can very comfortably do the surgery without IV sedation. And then that kind of freaks people out sometimes when they hear that, but people do very well. And especially if somebody comes to us and say they've maybe got some mild dementia, Alzheimer's, things like that, sometimes they actually will do better without any additional sedation, IV sedation. And so the answer to that, that's the long answer. The short answer is that you do not have to, are not required to have IV sedation for cataract surgery.
Perfect. But some people, there are some reasons why people would not.
There's some people personal preference, okay? And sometimes it's based on other issues that they have medically going on. It may put them at an increased risk for something. That could be a dementia or a mental status situation, or it could be a pulmonary, heart issue thing. Again, we have people get medical clearances, but sometimes the anesthetists feel it may be better to do it with light or minimal sedation.
So we do have patients who want to be completely put out.
Yeah.
We do not do that.
Jessica's just addressing that. Some people say you have to knock me out completely. And in our 30 years, we've just not had to do that. We can sedate you enough, or I can talk to you and tell you stories enough that we can get you through it. But we want you breathing on your own, and we want you looking at the light. We want you to be able to cooperate. So we don't have or don't want to put people completely out, right? But again, we've been able to get everybody through without that.
All right, let's see. This one says, I have a family history of macular degeneration. I don't have it yet, but my two siblings and my mother do have it. The form that isn't treatable. Does the possibility of macular degeneration down the road affect what lens would be used?
So absolutely. So it's really helpful when patients know their family history. Now, not everyone has that luxury, but if you do, many eye diseases do run in families. Glaucoma may be one of them, but macular degeneration may be. Now, it's not necessarily an automatic, fate for yourself, but knowing your family history and what brothers and sisters and parents, basically first to your relatives, is what we look for when we ask about eye history. So knowing that as a pertinent consideration, many times we will counsel patients about if they have that strong family history, they may want to go away from the multifocal variety because you lose a little bit of sharpness if you pick that lens and then you go on to develop macular degeneration. But that's an individual consideration for patients. We've had patients that didn't know their family history, had a multifocal implant placed years ago, and they still have fine vision. But many of us would not suggest that if you have macular degeneration to pick that multifocal lens. You would pick more of the toric lens if they have significant astigmatism, or the standard lens.
And just to piggyback and emphasize the point, just because somebody in your family has macular degeneration does not mean that you will, that you will not for sure get it 100%. So we'd recommend, being on multiple vitamins like Centrum Silver, something like that, and good antioxidants, as Dr. Stahl had mentioned, fruit and vegetable diet, that sort of thing, just as a preventive. But that family history would not preclude you from really using any of those lenses if you did not have macular degeneration at the time of the exam.
This is a good one. Dr. Stahl, is it your turn? Can you get too old to have cataract surgery?
Interesting enough, I don't think there is an age limit. I know my personal one, I have done somebody who was 105 years old.
105.
And actually, interesting enough, in the same week, I did the daughter and the granddaughter. Three generations had
Wow.
cataract surgery, and the 105-year-old woman recovered really, really well. So I don't think there's an age that you're too old for cataract surgery. I think everybody deserves an opportunity to see,
This one talks about this IV sedation. It says, does the IV sedation impact cost and is it covered by your insurance?
Yeah, so that's considered part of the anesthesia fee and anesthesia services. And the answer is yes, it's covered by insurance. Okay. And if anesthesia service is not provided at all, that means the person would not have to be in the room. But we always have the anesthesia provider in the room because if you had some unexpected health issue or something like that, they would be a vital member of the team. So in terms of reducing the cost of the surgery, does not really reduce that. Okay. But you can choose to not have that particular medication given.
Okay, that makes sense. And then we'll do it looks like we just have one more right now, and it says, I have cataracts and I've had them for quite a while. You guys are sort of known as the cataract guys, but I have other concerns about my vision. How comprehensive is that eye exam? Are you going to be able to find retina issues, glaucoma, all of those things?
All this very
Yeah,
complicated.
very, very comprehensive. So,
Yeah.
yeah,
Pack a
very-
snack.
very comprehensive.
All right, so we just have 3 other questions that Jessica, or I'm sorry, we have 4 other questions.
And that
just-
group answer was not to be dismissive of the question. It was just to say that you'll have a very thorough examination. The most common thing we'll hear is, that's the most thorough eye examination I've ever had. We'll know your eyes front to back, inside and out, and we'll be able to help communicate the findings to you so you'll understand what's going on with your vision.
And your lips and lashes.
Yeah.
And I can speak for, I know I can speak for Dr. Stahl and Dr. Knowles, but our primary concern is to get you seeing better. So we're surgeons, so we enjoy surgery and we like to do it because it helps our patients. But part of the comprehensive exam is to do the thorough exam so you can avoid surprises. Now, not to say all of us, there are surprises as far as, sometimes cataract surgery doesn't have the impact that we're hoping for. Most of the time it is, but part of that comprehensive exam is identifying other comorbidities, like Dr. Knowles had said, that may be impacting the vision and then guiding you through, how much can we hope to get back with cataract surgery by itself.
Absolutely. That way you can make an educated decision on what you're going to pick. Got it. All right, Jess, I'm going
All
to
right.
give you back this one.
Thank you. Okay. Thank you, Dr. Knowles.
Yeah.
Dr. Knowles, how does cataract treatment differ for patients with other eye conditions like glaucoma, macular degeneration?
Yeah, so the actual technical aspect of the procedure doesn't change at all. We still get the cloudy lens out. Now, we may be more attentive to pressure fluctuations after the surgery if it's a glaucoma patient, because glaucoma can be impacted by pressure in the eye. Macular degeneration, again, that's involving the retina, really doesn't affect anything in terms of how we do the procedure. If somebody's very nearsighted, we're maybe more attentive to fluid fluctuations in the eye, that sort of thing. So there are nuances that we pay attention to, but there's not any major difference in the surgery. The surgery is the same, and the post-op recovery and the post-op care is essentially the same.
Okay. Dr. Gillis, what are complications of letting a cataract go, never having surgery?
Right. So just like you don't have to wait till the cataract gets ripe, if you let the cataract get too big or too dense, many times it can make surgery a little bit more challenging on our part, but also lead to a little bit longer recovery and maybe just a little longer inflammation. But thankfully, we're all very experienced in even these very severe cataracts. Both Dr. Stahl and Dr. Knowles are very accomplished in their world travels and see some of the most complex diseases as far as cataracts go. So we're all very comfortable and capable of taking even dense cataracts out, but you don't want to wait too long. So if you're thinking you're starting to have vision issues, then it's a good idea to get an evaluation to see if it's time for cataract surgery.
If a cataract is really, really dense, just to piggyback on that, again, you can have some collateral increased swelling with the cornea and things like that. So we can delay the visual recovery. And people want to get the surgery done. They want to have pretty rapid visual recovery. If you're waiting a long time, and all of us have had this, you're doing the cataract surgery and you're in there and you're going, this is a very dense cataract. And you kind of thinking in your mind, if they had it done 5 years ago, it would have been easier for their recovery and a little bit shorter surgery. But in any case, we can still have very, very good outcomes with those very, very dense cataracts. But you don't want to wait until you're totally blind. Like, that's too long. You can come in sooner than that.
Yeah.
So I have a couple more questions and then we'll close out questions for the evening. And I'll put those. This one is a good one. So if you have a cataract in one eye and it's much bigger than the other, do you usually recommend having both done roughly at the same time or waiting to have the second eye done?
Most people, well over 90%, have a cataract in the other eye. And the reason they don't notice is because the one eye just got so bad that by comparison, they don't. So most of the time we're scheduling both eyes about 3 weeks apart. We let one eye heal, use the measurements, get a little better result on the second eye, and then do the second eye. Occasionally, in a young person, they'll have a cataract only in one eye. And then we do the cataract in that eye, and we wait till the cataract develops. But again, we live long enough, we're all going to get cataracts. We're all going to need cataract surgery. So it's only a matter of time. More than 90% of our patients have it in both eyes, and we do both eyes about 3 weeks apart.
So since everybody's going to have it, have either of you had it?
I don't think any of us have had.
None of us have had cataract surgery. I was going to piggyback just on something Dr. Stahl said about separating the surgeries. You'll hear if you look online, you'll see, gee, so-and-so had their cataract surgery, both eyes on the same day. And there are small numbers of surgeons that are doing that for various different reasons, but there are 2 reasons to not do that. And we're conservative. We want to make sure, like if somebody, heaven forbid, we've never had issues like that, but if somebody had a concern where, there was maybe a contaminated fluid or something like that would cause one eye to turn, to have a bad outcome. Well, now you've got both eyes involved with that. And then also by waiting until you're at least 2 to 3 weeks out, you really know how that first eye has responded. And if the lens power selection is optimal, you may do a little tiny tweak if you need to on the second one. You don't have that option if you're doing both eyes on the same day. You don't have that safety factor. You don't have the outcome assurance factor.
And Dr. Knowles, while you have the mic, can you talk about LASIK after cataract surgery?
Yeah, so LASIK is laser vision correction. Again, Dr. Stahl is the area's leading surgeon in that. And again, that can involve LASIK or PRK. Again, if somebody heals, somebody has cataract surgery and they heal and they're right spot on, let's use the golf analogy, okay? We're aiming for a hole-in-one with, I'm not a golfer, but everybody understands that, right? Aiming for a hole-in-one with the cataract surgery. If you get a hole-in-one or you're on the green and pretty close to the cup, you're pretty good, okay? But statistically, you've got, everybody's familiar with the bell-shaped curve. You've got statistical outliers that may be at one end or the other. They may be a little bit off of the green. They may rarely, not impossible, never say never, never say always. You can have somebody way out in the rough. What do you do with that? Okay. We have the luxury and ability, and that's why we have things that, that other practices maybe don't have. We have the ability to do laser vision fine tuning after the cataract surgery if we need to. If your eye is healthy enough, cornea is healthy enough, there's enough variation there that we can actually put it in, so to speak, with the laser. And so we have that discussion, and that can be a place then for laser vision correction to be done after the cataract surgery. It's typically PRK as opposed to LASIK. Nuance there is that it's not a flap as opposed to a flap. Don't want to expose the cornea to additional stress of a flap at that time.
So what about for patients who live alone? Do they need someone to help them?
Yeah, I'm gonna let Jess answer that.
So after cataract surgery, we just want you to go home, take a 2-hour nap. You do have drops and things to do. So it is nice to have someone there that can help you put those drops in and just make sure that you're getting them on time.
I
And
think that depends more on your capabilities
yeah,
before surgery, if you're able to live alone and get through.
Plus, you are sedated, and anesthesia strongly recommends you have somebody at home for the first 4 hours afterwards. So for both of those reasons, you do need somebody at home with you right after you leave.
And I think rarely, sometimes, pardon me, I'm kind of chipping. I'm talking too much tonight. Okay, all right. He's monologuing again. Okay. So, sometimes home health care can be made available to some patients, okay? If they don't have family or friends in the area. And we've done that for some patients where they'll have a home health nurse that can come help with the drops. And it touches on some of the variation. We're very conservative surgeons. We do the post-operative drops. You'll hear some people say, do surgery in both eyes the same day and don't use any drops afterwards. And you're going, well, we can tell you multiple reasons to not do it that way, but you'll hear about that, spectrum of care out there. But again, we're a reputation-based practice. We want good outcomes. We want you to see well. That bodes for you telling other patients about your care and your results. And so we want what's best for you. And so we do the drops, and we encourage you to have somebody home to help with those drops, help with the aftercare. If you can't find anybody in your circle or sphere of friends and family, then home health care nurses can be available.
Jess, this one might be for you. Do you happen to know the cost of a cataract evaluation? It's all subject to insurance coverage.
So I think it's 190, and
Is what it
then with
starts.
additional testing, there's add-on
So it would
for that.
typically start at
at
190.
190 for an exam. Yeah.
And deductibles, copays, you have a copay
Right.
for a specialist's office.
Yep.
Okay. That would be a good question to call the front desk and determine.
Yes.
So we can start there. Just a couple more. For people who have a fear of moving their head and botching their own surgery,
Yeah.
it's a fear.
It's not as bad as you're thinking it is. And again, we give you a little sedation so you're not real anxious. I have my hands on your forehead. If you're moving a little bit, I just say, hey, let's look back at the light. Let's hold still. Let's get through this. Again, I've never really had anybody who didn't get through it. So I think we can get you through it. I think your fears and your trepidations about it far exceed the reality. When you get done, you're going to go, oh, well, that wasn't so bad after all.
And
of
they come
course,
back for the second
There's
one.
some sedation involved here that helps
Right.
get you through, right? So,
Yes. We answered this one earlier, but the cataracts don't come back after surgery, but they will need their lens cleaned off once a lifetime. And once in a lifetime, sorry. And I'm not sure if we covered any complications for cataract surgery. I know we give a full consent form to go over before surgery.
Right. And so, we have very thorough consent form. In this day and age, if I give you an aspirin, I have to say that you could bleed out and die from an aspirin. And so in this day and age, you have to have, consent forms that are very long, and you kind of go, wow, why does it have to go through all that? It's because the medical legal climate that we're in. But again, my standard discussion with patients, the very worst thing could ever happen. One in about 10,000 patients could have loss of vision or loss of the eye due to a severe infection. And that is so rare. And none of us surgeons here have had somebody lose their eye as a result of an infection after surgery. And we've done over 10,000 surgeries, well over 10,000. So that's the very worst thing that could happen. But typically, maybe it's a little slower visual recovery if somebody's had a super hard cataract or they had some special corneal condition, that sort of thing. That's pretty much it. Or maybe somebody needing a laser fine tune afterwards because they're outside of the green on the golf analogy,
The more common things that aren't necessarily considered complications, but just may be requiring a little bit more attention would be like a high pressure. That's why we see you the day after, and that's not necessarily a complication. That's just part of the recovery. So there's a small but definite percentage of the people that we check on day one, and the pressure might be a little high, and that might require either an additional day in the office for a check or an extra drop to temporarily control the pressure. So there's some little things that we consider not complications, but just part of normal aftercare that may be variable depending on how your eye responds to the surgery.
Perfect. All right, guys. So we're gonna wrap things up on our side, and you've got one last question for the doctors for the evening.
Maybe
I do. Just why should patients consider
maybe two.
us? Why should patients consider us our office and you
We're-
guys for
so we're just
surgery?
going to go around and each bring up one thing. For me, I'm just say 30 years. You want a doctor who's young enough and yet old enough to have a lot of experience. Been doing this 30 years, seen a few things, got pretty good things.
Yeah, so at our practice, a unique thing is you're going to see the doctor for the evaluation. You're going to see the doctor for the surgery. You're going to see the doctor for the post-ops. There's some practices where you only see the surgeon maybe on the day of surgery, and that's maybe it. Okay, hard, sad to say, but that's maybe the case. And then that we offer full spectrum of care. It's not just the ability to do cataract surgery, but We have the ability to do the laser vision fine tuning afterwards if needed. Okay, we have the ability to offer these advanced lifestyle lenses, and we're comfortable using those because we're all experienced with those. And some practices and some doctors are not. So I think there's the things that we can offer, and your experience background are big factors.
And I'll say, my 2 cents to it is the people. I would say Dr. Stahl's been doing this for so long, and to be around for 30 years, you have to have also, patients like you. You have to have your workers to come work for you and stay with you. And he's just cultivated a great environment here where when you walk in, you've got a smiling face and someone checking you in, people that are experts at every level of your experience here. So whether you check in, your special testing, the doctor's evaluation, and then the checkout process. So we've got a fine-tuned process to value your time and get you as expeditiously but as thoroughly evaluated from start to finish, but in a very personable way.
Yes. Yep.
But we're more personal than a machine.
Yeah.
Yes.
It's nice having your own surgery center. You don't have to go to a hospital, so our surgery center's in the same floor on our building. It's on the opposite side of the hall. So nice having your own surgery center, same nice personalized people. That just makes a huge difference as to a practice where you have to go to a hospital or go to some other surgery center.
Yeah, and the certification, I mean, the doctors are all board certified experts in the area. The nurses are all, nurse certified, and the technicians are certified ophthalmic assistants and technicians. We have official ophthalmic surgical assistants, et cetera. So the level of expertise and certification of all the staff.
And the one other thing that I wanted to add was we have the comfort and the experience to offer a variety of both the advanced and standard lenses, but then we have the laser that lets us fine tune and get you closer to hopefully get you as close to glasses independence for distance or whatever your needs may be, to fine tune and really customize and get the outcome as good as we can.
And then last, between the three of us, you're seeing some of the three most experienced surgeons in Miami Valley. We've done more than 50,000 surgeries. We don't just do that surgery, we track all those results. So people ask, well, how come you get such accurate results? Because we track everything. We build formulas, we build nomograms, we look at the outcomes, we make adjustments, we fine tune things. So 30 years experience and over 50,000 cases between the three of us, you're going to get pretty good results.
Right. Find our paperwork might have spelling errors, but no math.
If we find a spelling error, we're correcting it.
Right.
All right.
Well, I want to thank everybody for the seminar, for tuning in. That was a longer seminar than we usually have. That's great. Great questions. So do you want to do that tonight?
Do you have time?
We do not.
Okay.
Okay.
We're on the count.
Okay.
All right.
All right. Well,
Well,
thank you, everybody.
If
Thank
you guys
Mike.
need
Thank you,
cataract
Jess.
surgery, call our office 937-427-2020.
Ooh, good recovery there, Jeff.
I should have gave the other number.
And you can visit us online at stallvision.com. We have online quizzes for cataract surgery and stuff for cataracts.
Yeah.
Thanks. Oh yeah, if you rewatch it, Lakin, tell them how they do that.
So if you guys do want to rewatch, we will have it posted to YouTube within a couple of days. You can always watch all of our other seminars that are under the Stall Vision YouTube page until we get this one posted, but we'll have it posted in a couple of days. All right. Thanks
Thank you,
for
everybody.
Good evening. Thanks for tuning in.